Nelson Mandela said, AIDS is no longer just a disease, it is a human rights issue. Metropolitan Health Group and Kwalsa are proud to partner with the Desmond Tutu HIV Foundation, a leader in HIV research, to sponsor the Tutu Tester.
Being a subsidiary of Metropolitan Holding, Metropolitan Health Group subscribes to the value of Together We Can. And one of the key things that we've done, Metropolitan Health Group, is look at partnering with communities that are within our reach to ensure that we drive community involvement, community upliftment in issues that are pertinent to the communities that we serve. So really it's about partnerships.
The staff of the Desmond Tutu HIV Foundation is motivated by a passion for humanity and the vision of a world without AIDS.
The Tutu Tester is a mobile clinic that provides quick finger-prick HIV testing and screening for diabetes, obesity, and hypertension.
The Tutu Tester illustrates a magnificent example of how private and NGOs can come together to do a good thing. Metropolitan Health Group came to the table and said, let's supply the vehicle. The Desmond Tutu HIV Centre has come to the table to say, well, let's provide the ideas and the expertise. Together, I think it is really honing a possible solution for a serious problem in South Africa.
This is in keeping with the belief that HIV should be viewed as a chronic, treatable condition rather than one attached to stigma, discrimination, and shame.
It's almost like a general health check, and people don't know whether they can be found to have diabetes or hypertension or HIV.
Each day, a small team of dedicated nurses, counselors, and educators travel from the UCT Medical School at Groote Hospital to the hustle and bustle of township life in areas such as Masiphumelele, Nyanga, Simonstown, Cork Bay, and Crossroads.
Well, essentially we arrive with our mobile van and we have a pre-selected spot that we'd like to be, whether it's a shopping centre or a taxi rank, and sometimes it's even just on the side of the road. We park the mobile, we then have a gazebo that we set up and a few tents. In the meantime, the van gets cleaned, the rooms get made ready for testing, and we find, without us actually having to do much while we're setting up, that people are quite curious and they come along and they say, well, what are you doing here? And we'll say, well, we're offering HIV testing in addition to testing for diabetes and hypertension. And people come through, and once you start having a crowd, people waiting, it just draws a crowd, and so we find that quite easily we are able to get people to come for testing.
According to the Desmond Tutu Foundation, one of the biggest obstacles to effective prevention and treatment strategies is that very few South Africans know their status, and even fewer people test regularly. The Tutu Tester is highly mobile, quick and efficient, thereby facilitating regular testing and caters to underserviced areas in the Western Cape. The Tutu Tester vehicle has been especially modified to provide state-of-the-art testing facilities, such as the CD4 machine, as well as private areas for counseling and consultation. Because testing is offered outside of the traditional clinical setting, the Tutu Tester's message is, testing is for the healthy too.
And you feel comfortable knowing whether you're HIV positive or negative. The important thing is, the first step to take is to get tested.
The Tutu Tester, I think it's a great concept. It's a community outreach program. It's wonderful to see everybody getting tested. It's the sense of everybody wanting to know their status, a sense of freedom, and it's good to see the involvement of the community.
The Tutu Tester sets out to make testing accessible and promotes disease prevention as a self-initiated activity.
Many people are walking around not knowing that they actually have a life-threatening disease that can be managed, and that can be controlled. And it's just a matter of testing. And the health services being as it is, it's not always as easy accessible as one would like to think.
People testing negative for HIV are advised on managing their risk, as well as how often they should be tested. Those testing positive are immediately given a CD4 test to assess the progress of the disease before being referred to their nearest treatment center.
What is so tremendous about this service here is that within 5 to 10 minutes they will have all of their results, and if any abnormalities are found, we then refer them to the various clinics for further treatment.
Since the program's inception in May 2008, thousands of individuals have been tested by the Tutu tester.
We saw almost 4,700 people, just under 500 people tested positive, and we saw a lot of males, almost more than 60% of the people we saw were males. So we're capturing the sort of elusive group of people that don't normally present to clinic facilities to test.
This shows that the on-the-street approach is starting to pay off. Through our partnership with organizations that share the same vision for a healthier South Africa, Metropolitan Health Group and Kwalsa are able to promote access to healthcare and health education directly to the people. Metropolitan Health Group. Together, we can.